everyone, my name is Dr. Nousheen. I am from Karachi, working as an assistant professor, and my topic is predictive of mortality of species. Its currently affects estimated 3 million people globally, so its burden is high. And you can see there are multiple spectrum from single nodule to Aspergilloma to multiple cavitation to a fibrosing pulmonary Aspergillosis. So why we conducted this study? So the reason was, as we know that patients with CPA have a variety of underlying pulmonary diseases, like the patient may have TB, COPD, bronchiectasis, asthma, so there are a variety of diseases. And the prognosis is usually poor, ranges from 17.5% to 85%. The data from the European study suggests that the survival from 1 year survival 86%, 5-year survival 62%, and 10-year survival is 47%, but mortality is high in patients with NTM and COPD. However, there is a recent study published from Japan, and it shows that the survival decreases if the patient have interstitial lung disease. And the 1-year survival is 78.7% with 61%, and 5-year survival is 47%. So you can see it is less as compared to the European data. So we have limited data from our country, so we plan to explore the predictor of mortality of CPA incorporating the diverse pulmonary condition, and we look for the long-term prognosis of our patients. So this was a retrospective study. It was conducted for last 15 years. Total 75 patients was included who had a definitive diagnosis of CPA. 11 were excluded because there were no observational period, while 64 cases finally included for the analysis. So here are the results. The overall observation period in our study was 1,095 days. For the survival, it was 1,095, ranges from 210 to 2,900 days. And for the non-survival, ranges from 365 to 1,095 days. So this is the baseline characteristics, and you can see the age was 45 plus minus 15. Majority were male, 64%. And when you look into the type of pulmonary aspergillosis, the predominant was chronic cavitary pulmonary aspergillosis, 48%, followed by aspergilloma, 37%. When we look at the underlying baseline pulmonary condition, you can see there are a lot of diseases. The majority was tuberculosis, 76.6%, followed by bronchiectasis, then chronic obstructive pulmonary disease, then asthma and ABPA. There are few patients, like there were 9.4% patient had emphysema, 6.3% had pneumothorax, and 6.3% patient had ILD as well. While in any other diseases, we had NTM, we have sarcoidosis, we have autoimmune diseases, and malignancy. Antifungal treatment received by 81%, while surgical excision was done in 42%, and mortality was 18.8%. This is the underlying pulmonary condition and their effect on the survival, and you can see that as compared to TB, pneumothorax, or other diseases, ILD is associated with poor prognosis if patient have a CPA. This is the univariate analysis, and on the univariate analysis you can see if the age is more than 65, if the patient has interstitial lung disease or have a surgical excision, it has an impact on the outcome of the patient with CPA. And on the multivariable analysis, we saw that ILD has a negative impact on the mortality, while the surgical excision has a good outcome on the outcome of the CPA patients. Now closer with the graph, because it will give you a better review. So this is the overall survival of our patients. You can see the 1-year survival is 86.6%, 3-year survival is 78.7%, and 5-year survival was 72% in our patients. Now with respect to ILD, now this graph is explaining everything with compared to other diseases. The patient of ILD, when they develop CPA, there is a rapid decline in the outcome of the patient. So there is a mortality is high if the patient develops CPA with ILD. This is the graph that's showing surgical excision impact on the mortality, and you can see those patients who had a surgical excision, as shown in this blue line, has a better outcome as compared to those who had surgical excision. And we know that the surgical excision is always better, because if your patient has a unilateral with a good lung parenchyma, it's better to go for surgical excision. So patients who didn't go for surgical excision, yes, the outcome is not good. So the conclusion of my study is the survival in our study was 86, 78 and 72%, 1, 3 and 5 year survival. The most common type was chronic capillary pulmonary Aspergillosis, and ILD is defined as an independent prognostic factor associated with increased risk of mortality. We found surgical excision is associated with decreased risk of mortality in CPA patients. Now what are the way forward? This is the first study of Pakistan that we conducted to look for the predictor mortality in the CPA. There is a problem like it's a single center study, it has a small sample size, and of course a single center study. So we need a multi-center study, we need prospective study because it's a retrospective study. And we need registry to better understand these patients. We also need long-term follow-up of these post-TB patients to look for the post-TB complications. And this is my email address. Anyone who is interested for collaboration can contact for this, and we are ready to collaborate. So thank you very much.
So I invite Dr. Kamran for an excellent presentation on video-assisted thoracic management of primary spontaneous pneumothorax. Dr. Kamran.